When did you notice the alcohol consumption becoming problematic?
My mother's desire to drink developed gradually, or perhaps we noticed it gradually getting worse when her sundowning was becoming more obvious. The more alcohol she drank, the more confused and agitated she would be in the evening. Mom had always been someone who had a glass of wine with dinner, but it was never an issue before. While it was normal for her to pour wine for herself during dinner, she usually only had one glass. As her insight and capacity to regulate herself lessened, that glass of wine just became bigger and bigger. It started out with one glass per night and very quickly escalated to a third of a bottle of wine. In what seemed like a very short amount of time, her perception about appropriate amounts and self-regulation was gone.
As a result of her alcohol intake, what issues did she and your family encounter? How did the dementia aspect complicate her issues with alcohol?
Alcohol was a big contributor to her dysregulation at the end of the day. Both my parents have dementia. During that time, my mother was still the primary caregiver for my father. And due to the alcohol, my mother would become aggressive with my father and refused for others to care for him. She wasn't able to provide care for our father after she consumed alcohol, which placed him at greater risk for falls. Having dementia was bad enough, but her wine consumption made everything worse. She became physically aggressive towards the caregivers, which is not something she would have done in the past. She was verbally abusive to my father, which is also unlike her, since she and my father had a very loving and respectful relationship.
What interventions did you take to try to help your mother to stop drinking? What did and didn't work?
Well, we tried a bunch of different things, but nothing worked. They all had some value, but simply just didn't work. I would go to the grocery store with her to prevent her from buying alcohol, but that didn't work because she would order online or call the local grocery and have the wine just delivered to her house. Several times I emptied out her wine bottles and replaced it with non-alcoholic wine. It didn't work because at that time she recognized the taste and emptied the bottle in the sink. What did eventually work is diluting her wine incrementally. So over a period of 4 months, we diluted her wine gradually with non-alcoholic wine. When she would go out to dinner, the caregivers would discreetly give the waiter the bottle of non-alcoholic wine to serve to my mother. That way she didn't feel left out when everyone else was drinking. She knew it didn't taste the same, but she complained less and less. We also spoke to her friends about the alcohol issue, so they knew not to encourage my mother not to drink. Also, I started to introduce another option for my mom. Luckily for me, Diet Cola worked, and we always had it available in the house or other social gatherings.
What advice would you give other caregivers? And what did you learn from this experience?
Be respectful of what alcohol represents for your loved one. For my mother, alcohol was linked to happy memories because it reminded her about times she was with friends and colleagues. It reminded her of times she shared with my father. So as much as possible, I didn't want to rob her of that. So by providing her with non-alcoholic wine, she was able to be social without actually consuming alcohol. Also, make sure to train your staff about how to dilute the wine appropriately. Each person in the household needs to be in compliance with not having alcohol in the home.